Kia ora. Thank you. Well, kia ora everybody. I'll take my mask off for this part and we'll put it back on again afterwards. It's good to be in Auckland today. This is, of course, my first visit to Auckland since the re-emergence of COVID-19, so it's good to be back amongst you all. I'm joined today by Dr. William Ranger, the Director of the Auckland Regional Public Health Service, who's going to update us on the latest case numbers and information shortly. But before I hand over, I do want to just acknowledge the incredible work of the Auckland Regional Public Health Service. They have been working tirelessly over the last 3 and a bit weeks. ARPS has been at the forefront of the contact tracing work that we have been doing in trying to contain the current community cluster of COVID-19. Since the current outbreak began, our COVID contact tracers have identified 3,162 close contacts, and they've successfully contacted 2,984 of them so far. They've been consistently hitting the gold standard target of contacting 80% of close contacts within 48 hours. That's a critical goal for us if we're going to stop the growth of the cluster and keep it under control. That work has made a significant difference, and it's one of the reasons that Auckland has been able to begin the transition from Alert Level 3 back down to Alert Level 2 with confidence. So I'd like to thank you, William, and your team here in Tamaki Makaurau for the work that you've been doing to keep us all safe. So if you could now give us the regular case update and perhaps tell us a little bit about the work of your team, and then I've got a few other messages to share and we'll get into question and answers.
Thank you, Minister, and kia ora koutou katoa. Today there are 2 new cases of COVID-19 to report in New Zealand, one in the community and one in managed isolation. The community case has been epidemiologically linked to the Auckland cluster. The case in managed isolation is a woman in her 30s who arrived from the Philippines via Hong Kong on August the 29th. She has been in a managed isolation facility at the Distinction Hotel in Christchurch and tested positive around day 3 of her stay. Since August the 11th, our contact tracing team has identified, as the Minister has said, 3,162 close contacts of cases, of which 2,984 have been contacted and are self-isolating, and we are in the process of contacting the rest. There are 92 people linked to the community cluster who have been transferred to the Auckland quarantine facility, which includes 67 people who have tested positive for COVID-19 and their household contacts. There are 7 people with COVID-19 in hospital today, 1 in Auckland City, 2 in Middlemore, 2 in North Shore and 2 in Waikato. 5 people are on a ward and 2 are in ICU, 1 each in Middlemore and Waikato hospitals. There are 16 previously reported cases who are considered to have recovered today, all community cases. With today's new cases, our total number of active cases is 115. Of those, 36 are imported cases in managed isolation facilities and 79 are community cases. Our total number of confirmed cases of COVID-19 is now 1,408, which is the number we report to the World Health Organization. Yesterday, our laboratories nationally processed 10,521 tests for COVID-19, bringing the total number of tests completed to date to 788,081. I'll just say a few words about close contacts and our advice to close contacts. I really want to emphasise for people who are identified as close contacts of someone who has COVID-19, there are 2 key things that we need you to do. The first is to get a test. All close contacts need to be tested, even if you don't have symptoms. The second thing is if you're a close contact of someone who has tested positive for COVID-19, you need to stay at home in self-isolation for the full 14 days. Your 14 days starts from the day you last had contact with an infected person. Even if you have a negative test early on, you can still be developing COVID-19 and be infectious, even if you feel well, and it can take 2 weeks to show symptoms. So it's very, very important. Comply with isolation and be tested. And this is critical to stopping the spread of the virus to other people if it turns out you do have COVID. So I'd just like to say a few final words about ARF's role in contact tracing, as the Minister has mentioned. On any one day, we have around 100 or more staff at ARFs who are working either in contact tracing directly or symptom checking teams or supporting the response in a general sense. Contact tracing involves, first of all, interviewing cases who may have passed on the disease while they were infectious, calling the contacts of identified cases to inform them of this status, to determine if they have COVID-like symptoms, to place them into isolation, and to provide appropriate information to support their isolation, and also to provide them with the welfare support to help them to stay in isolation. We then provide daily follow-up of close contacts once they're in isolation to check that they are maintaining their isolation, monitor them for COVID-like symptoms, and provide advice to assist with any welfare needs that they may have up until 14 days after their exposure. We have Maori and Pacific contact tracers who are involved with cases from these communities, talking to cases, to families, to churches, to make sure that they understand what is required and have the support necessary for quarantine, either in a facility or at home, because we do understand that it can be a challenge for people and there is a lot of support available for them. ARFS has led most of the case investigations and rapidly surged up following the re-emergence of COVID-19 from August the 11th. Our teams are currently ringing more than 200 close contacts every day to carry out symptom checking and check on their well-being. At the peak of this outbreak, that figure was more than 500 people a day. In the last week, we have contacted 85% of close contacts within 48 hours of being identified. The National Investigation and Tracing Centre, based in Wellington, provides coordination of the contact tracing service to ensure an effective response. And some of the larger efforts, like schools, have been followed up by this national centre. Public health units from around the country also have supported ARF's response by undertaking contact tracing and monitoring of contacts on behalf of ARFs using the National Contact Tracing Solution to manage and delegate that work. This recent resurgence provided the opportunity to test the national delegation framework with public health units utilising the National Contact Tracing Solution to manage workflows across the entire contact tracing service nationally. This has strengthened the ability of New Zealand to respond to COVID clusters and future outbreaks. Thank you very much.
Thank you. Thank you very much, Dr. Ranger. And of course, it's not just the, I'll just make sure I sort myself out here. It's not just the contact tracing work that's made the difference to the containment of the latest outbreak. We've also seen record testing numbers across the country and here in Auckland particularly. So I want to thank and acknowledge the work the DHBs, the District Health Boards, have done in supporting that testing effort. They've been instrumental in many, many parts of the response, from the high levels of testing that we've seen, reaching out into our Māori and Pacific communities in particular, and ensuring that our hospitals continue to function effectively during what is a very challenging time. And I want to thank all of the workforces across the health system for their enormous contributions. Just a reminder, this outbreak affects all parts of Auckland, from the North Shore right the way through to the south. It doesn't matter where you live or work. Please continue to take action to protect yourselves, to protect your whānau, and to protect your community. Aucklanders have done a great job to help keep this outbreak under control and to get us to what we're calling alert level 2.5, but we cannot relax just yet. So for Aucklanders who are travelling outside of the region, our message remains, please take your enhanced alert level with you. So act as if you are still in Auckland when you're outside of Auckland and follow those same rules that apply to you in Auckland if you are travelling outside of the region. A reminder to everybody again, it's good to practice good hand hygiene, physical distancing, coughing and sneezing into your elbow, wear a mask when you are in public and when that is appropriate. It's been really heartening to see how quickly people have taken to the use of masks and face coverings. We're seeing great use of them on public transport and also when people are out and about in public. Please continue to keep track of your movements using the COVID Tracer app or a manual diary if that is better suited for you. And perhaps most important of all, stay home if you're sick. Please stay home if you're sick, and if you're showing symptoms of COVID-19, please get a test, and then if you're showing symptoms, stay home until you get the test result. Being in Auckland, I do want to acknowledge two other key groups that have been central to this pandemic response. First, primary care, which I know has been at the front line when it comes to the testing. So in general practice and urgent care clinics, running the community testing centres and in pop-ups, we have seen an incredible effort. Since this outbreak began, we've seen more than 160,000 tests across the Auckland region. And I know that primary care leadership has been working very hard to help make sure that happens. I want to acknowledge all of the community leaders in Auckland for their work in encouraging people to say yes to the test and make sure that we're getting those testing numbers up. And again, thanks to iwi leaders, religious leaders, school principals, employers, and local and national elected officials who have all been playing their part in this response effort. From 11:59pm tonight, Thursday, it will become compulsory for the COVID Tracer QR codes to be displayed on public transport, buses, trains, ferries and taxis, including Uber. We've seen the spread of COVID-19 via public transport in this latest cluster that we are dealing with, so it is important that we take the opportunity to strengthen our protections in this regard. The addition of those QR codes will help in that regard. We are encouraging people to please make sure you're using them. For those who are displaying QR codes, it's also a reminder you don't need to just display one QR code, print multiple copies and make them as easily accessible as possible so you don't end up with queues of people lining up to scan their QR codes. The Ministry, or we have been asked, is the QR code data being used? The Ministry have issued 6 alerts to people who have the COVID Tracer app so far in their efforts. The contact details that people give us when signing up for the app are certainly being used in the process, and we have released today the latest app update, which adds additional functionality, including allowing us to customise the alerts that we're sending out to people when they have been at risk of exposure to COVID-19. We're allowing people to edit their digital diary entries, and also to save their national health number into the app, which will help to speed up the process if they need to get a COVID-19 test. One final message from me. This morning I spent some time signing out correspondence, as we do as ministers, and I will have to say I was alarmed at the number of letters that I've received from people concerned that the government would be making COVID-19 vaccinations compulsory. This is a direct result of deliberate misinformation that's being spread through social media. The government is not making COVID-19 or any other vaccinations compulsory. We will, of course, when we have a vaccination available, be encouraging people to take the vaccination because it will help to keep everybody safe, but the government is not going to be making the vaccination compulsory. And with that, I'm happy to take your questions. Yes.
Just on masks, Minister, many bus drivers in Auckland have been spotted not wearing them. Is that acceptable?
No, bus drivers are expected to wear masks. In fact, it is the rules. Bus drivers should be wearing masks, as should the drivers of small transport passenger, public transport vehicles like taxis and Ubers. It should be, and we'll certainly take steps to make sure we're reminding their employers to feed that information through, and we will be looking to see whether there's any issue around supply of masks, for example, so that if there is an issue there, that we can resolve that quickly.
So they could be fined or something like that if they are found to not be wearing masks, just like a member of the public could be?
They could be, but ultimately, like as we've said, in this early phase, we're working on encouragement and on ensuring that people know what the rules are, making sure that that's all communicated clearly. We are seeing high levels of compliance, but if there are issues where there are persistent pockets of non-compliance, then of course we have options and we can take further action there.
Just on NCEA, I mean, some schools in South Auckland in particular are reporting, 30% student attendance. The outlook for external exams is problematic. Would you consider calling off NCEA exams and relying on derived grades?
So we've already extended the time frame for NCEA exams, so we've pushed that out so that they'll be a bit later this year than they normally would be. We've also pushed out the date for submission of portfolios, which is also part of the NCEA assessment process, and we have put in place a supplementary credits regime for those students who are still doing learning but maybe wouldn't have been able to do the level of assessment that they normally would have been able to do in a year. Of course, we're constantly looking at that. We're also looking again at whether we can do more in the summer period to help those students who may fall a few credits short and need to do a bit of catch up over the summer period so that they can go on to further tertiary study next year. And Te Kura, the correspondence school, are working very closely with the ministry around how they might be able to support that. They have supported that kind of approach in the past.
When you say you're looking at it, do you mean that the exams could be put off for some pupils?
We've already delayed the exams. Of course, we will seek. We're always getting feedback from Auckland schools, and I'll continue. The ministry and I will continue to look through that very carefully. We've not made any further decisions about delaying exams at this point, though.
There are primary school principals, Mr. Hipkins, who are suggesting that they don't think people will come back in maybe until term 4. I mean, what reassurance can you continue to give to parents who are nervous, especially in South Auckland?
At alert level 2, it is safe to send your kids back to school. So that is the key message. We get we have this advice rigorously tested. We get a variety of different, public health experts feeding into that process. It is safe to have your kids back at school at level 2. Schools are aware of what the additional things they can do are to keep kids safe and to keep everybody in the school community safe. So please, my plea to parents really is do send your kids back to school. They're losing valuable learning time, and there really isn't the public health risk that really should be resulting in those kids staying home.
We've had some people who have more up-to-date, just in terms of the COVID Tracer app, a number of people who have up-to-date and new Huawei phones who can't download the Tracer app on their new Huawei phones. Are you concerned that there might be problems there? Are you aware of that?
No, I'm not aware of that, but certainly we'll have a look at that. The developers, it's actually being developed by an external provider for us, and I know that they're working very hard to make sure they're keeping up to date with every new operating system issue and every new phone issue. But of course, technology moves fast, and they have to keep moving fast in order to keep up. So the latest update, the one that's being released today, of course, will include then the next iteration of updates to account for operating system updates, but we'd have to look at if there was a particular model that wasn't being adequately serviced, then of course we could look to issue a special update for that.
Could we get details on the latest community case, Dr. Ranger, just whether it was picked up in the community or whether it was picked up from someone in self-isolation at the moment, and what it's related to?
I just have to check my information. It's a family member of a known cluster, the Americold cluster. I think it's a young person in their 20s, 21-year-old male who's a household contact associated with Americold.
Were they in isolation at the time?
As a household member, they would have been in isolation.
Are you able to give us some sort of breakdown on the number of these positive cases in the community that were found within an isolation context rather than picked up at community testing? Because clearly, as you isolate these cases, there is still some, I guess, in the community that are being picked up. How many are being picked up in?
The vast majority of confirmed cases have been identified through contact tracing and testing as a result of that. I can't give you an exact number, but it's an overwhelming majority.
How many, though, would be being picked up at testing stations in the last week? Have you got an idea of a percentage even?
I think it would be close to zero in the last week.
Does that give you confidence then that we are on top of this outbreak?
I think we can be pretty confident that we are on top of this. If we look at the overall numbers that are being identified on a daily basis, in the last 24-hour period, there was one new case in Auckland linked to a known situation. That's encouraging. In the previous 3 or 4 days, it's been less than 5 cases a day. About a week ago, it was between 5 and 10. So if you imagine the epidemic curve, it peaked about 2 weeks ago. It is undulating downwards. We've had the Mount Roskill church congregation, which has given a little spike, but the direction of travel is downwards. So all the current clusters that we're aware of and working on, we believe we have well contained, and so we have confidence that the general direction is positive. But we do, just to say, we would expect to see cases for probably another few weeks. Sorry.
Did Auckland reach its testing target blitz of 70,000 tests for the week ended yesterday?
I might ask the Minister to answer that.
So do you want more testing in Auckland as well?
The answer to the second question there is yes, of course we do want to see that testing continue. So we saw about 10,000 swabs processed yesterday, just over 10,000 swabs processed yesterday. I'll be very happy if that level of testing continues for a while longer, because again, it's just that gives us that extra reassurance that if there are any other cases out there that we haven't picked up, that the net hasn't gathered up yet, that we're going to identify those. So I think we said we wanted an average of around 10,000 tests a day for 7 days, so around 70,000 tests. We wanted the majority of those to be in Auckland, and we've hit that target. I think we got about 67,000 overall. So we were, there or thereabouts in terms of the overall testing target we set for the 7 days. And then obviously we've seen a good number of tests yesterday, and we're seeing that testing continuing. So we do want to see those numbers stay up. We wouldn't necessarily expect them to be staying up at 10,000 tests a day indefinitely, but in this period of time, when we're transitioning down through the levels, that an enhanced level of testing gives us all good confidence that there aren't other cases going undetected. And if I could just come back to the previous point, one of the things that the Cabinet looks at when we make decisions about alert level changes is the number of cases, the nature of the cases that we're seeing. So it's not just the number, because you can have a large number of cases, but they can all be known, for example, and they can all be people who are already isolating, and that wouldn't necessarily cause concern. So over the last couple of weeks, we did see some days where we saw quite a high number of community cases, but they were often directly linked to one another. So they were a series of, it might have been an event that everybody attended, and therefore we saw a group. So they were already isolating, so that in itself doesn't create a huge degree of extra anxiety. On the other hand, a smaller number of cases that are not in any way connected, and that it takes a while to connect, those are the ones that frankly keep me lying awake at night worrying about. Normally, of course, they are linked, and we've seen that through this episode. This episode we've been dealing with. Sometimes it takes a day or two just to gather all of that information, but we're always looking at the nature of the cases and the relationship between them when we make those alert level decisions.
So, Minister, those levels of testing though in Auckland, let's be honest, they aren't at the levels. I know that you sort of said 10,000 nationally and 7,000 pretty much in Auckland, but really that number hasn't been hit since last week. I think some have been very close, but they've also been pretty low and some days only 4,500. I mean, you have to be a bit concerned given also now that you're asking for people who are close contacts, who are asymptomatic to come out.
Yeah, so we do always anticipate, sadly, a drop in testing numbers over the weekend. There's something about New Zealanders, they don't like to go and get tested in the weekends, and that's been a constant feature of our COVID-19 testing since we started it earlier in the year. But we have seen higher than our average test numbers on weekdays, on some of those weekdays, which has allowed it to balance out overall. So The issue is, I mean, we want to keep our testing numbers up, so we've still got a big push on our visibility around testing. I was down at Otara earlier on and had a walk around the market there, saw the testing station is still there, people can still drive through, it's still very accessible. They didn't actually have anybody in there being tested as I walked past it, but we're still going to have that real focus on keeping that visibility up and making sure that people can get tested easily.
Is it possible the rest of the country will come out down to level 1 for Auckland? Do you see that as likely?
Look, that's very hypothetical at this point. I think the changes, we'll be looking at the number of new cases that we're seeing. We'll be looking at the practical implications of any changes to alert level. So one of the reasons that we didn't make any change to the rest of the country as Auckland moved from level 3 to level 2, of course, is that Aucklanders get a lot more mobility as they come out of their level 3 restrictions. And so that's a time when we just need to be vigilant around the rest of the country that we're not seeing any spread around the rest of the country as well. So again, we're wanting to see our testing numbers maintained at a higher than normal level, and we have been maintaining them at a higher than normal level around the rest of the country for a period of time as well. Just again, for that purpose of surveillance, just to give us all confidence that if there's any further COVID-19 out there that we're picking it up.
Just on the confidence of cases, I mean, you said on the RNZ's checkpoint that in all of the cases, quote, there are either an epidemiological link or a genomic link. Are you sure that that's accurate?
Yes, except for the maintenance worker at the Ridges, who is obviously not linked back to the cluster. And there's, I think, one recent case, i.e. a case that's been in the last 2 or 3 days where that's still under investigation. That tends to be the case. But every other one, there's either one or the other of those links. So there's either an epidemiological link, i.e. we know who they came into contact with, who is likely to have given it to them, or a genomic link, which means that we know that it's the same virus that they've picked up. I've always said too, in the first sort of 48 hours after you get a case, sometimes it will take a wee while to nail that down. But yes, they're all being linked. And I think in the one case that was under investigation, there was a likely epidemiological link that was still being absolutely nailed down.
Why is the Health Ministry telling me then that there's no epidemiological or genomic link to the person who tested positive whose brother went to Hobbiton?
That one is still under investigation. You're correct. So yes, no, that is the one that is still under investigation. Yes, you're correct.
Okay, so is that important? Is that the kind of case that keeps you awake at night, as you say?
Look, we do look very. I'm not sure what's happened there. Sorry, the lights have gone out. I don't know if you. Yeah, it wasn't the question. So do you want to run through that again? So I lost track of one.
So we know that in fact there are cases where we can't establish any contact link or science link. So are those the cases that worry you?
In that one, the result was. I don't actually have the details of that case in front of me. I don't know whether. Yeah, I might get our public health officials to talk to that, but there was additional information we were supplied that eased our anxieties around that particular case, but again, I'll get our public health officials to comment on that.
Yeah, I don't have the details right in front of me, but what, with the Hobbiton case, I think the key issue there is that it is likely to have been a historical exposure. And that there has been no onward spread as a result of that. So that makes us believe that there's no further risk associated with those cases.
So the fact that it wasn't linked to the Auckland cluster, so it's not H111. So what strain of the virus was that one?
Look, it's B111, and I can't recall.
Okay, and just finally, you said before you have confidence the clusters are contained or you're on top of it or something along those lines. How can you have absolute confidence when you don't know the source of the original Auckland cluster outbreak? You don't know some of these other cases. I mean, that still must be an area of concern because you have no idea how this cluster actually started or how the subcluster from the church started.
It's a matter of certainty versus probability and likelihood, and there are a number of factors that we can consider that give us doubt or certainty. So one is the fact that all cases that are coming through, except for the maintenance person, are related to the B11 cluster. So with all the community testing that's going on, there's no new strain that is being identified. So that's one piece of information. The other piece of information is that with the community testing going on, as I said before, the vast majority of cases are arising either through identification through contact tracing or through the appearance of symptoms, which is a minority. And the third thing is our ability to contact trace around new cases when they do emerge and understand the transmission pathway onward from those cases. So putting together all those pieces of information, as well as looking at the overall epidemic curve, it gives us confidence. But it's a probability question.
Dr. Ranger, can you explain how the provision of information to primary care and general practice in particular has changed since the pandemic began?
So could you just say that again?
The information in terms of testing criteria, updates, all that stuff.
Oh, yes.
From us to general practice.
Yes.
How has that changed since the pandemic started?
So the policy around testing criteria has changed from time to time during the whole course of this current outbreak and the wider outbreak as the epidemiology and the alert levels change. How those policy decisions are made centrally, and then they're communicated to primary care through the northern region, through the DHBs, through established communication mechanisms.
And in terms of FTEs, what are us FTEs now compared to the start of the pandemic, and especially around speakers of Māori Pacific languages, Asian languages?
So we have we've more than doubled our FTE. So I think I said before, at any one day we've got 100 or more people working on COVID. In terms of our overall workforce, we've got 250 plus, and we're usually at around 140.
And that was at the start? And what was that at the start of the pandemic?
Sorry, say again?
What were your FTEs at the start of the pandemic?
Around 140. Yeah. So I just go on to say the other part of your question was about Māori and Pacific. So we've established a Pacific team for contact tracing, interpreting services and provision of welfare for Pacific peoples. Likewise, we've established a Paiora Māori approach which has the same capability. So we've got specific skill mix to support those particular populations.
It's very hard to find contacts that are being handed, they're being assisted by the whānau and South Seas, those sort of entities.
Is
Can you
that
give an idea of what sort of percentage numbers they're helping with, and sort of maybe discuss
well?
what they are providing?
This in this current outbreak, there's 75+% of cases are Pacific, and a proportion are also Māori as well. So what we do understand is that in order for people to understand and work with our quarantine and isolation requirements, they often need a lot of welfare support. There's things like food, but there's also income and housing provisions. So that's where the providers that you mentioned, the whānau ora, the Pacific Futures providers, work with us. In terms of an absolute number, I can't give you that off the top of my head, but it is a majority of cases given what this outbreak looks like.
Can I just ask on the Mount Roskill Church, has it been established that some church members were meeting in lockdown levels for prayer meetings or other meetings?
Just say that again, sorry.
The Mount Roskill Church,
Yes.
Were some members meeting during lockdown for prayer meetings or any other kind of meetings? Has that been established?
The families that we are working with, we haven't found any exposures associated with any such events. from our contact tracing, we haven't found any evidence of that.
Minister, have you, can I just ask the Minister, have you seen any evidence of that, or have you read on that?
My understanding is that very early in the lockdown there were a couple of dates in question that were being investigated. I don't have those with me, but I'm certainly happy to get those details to you.
So they were meeting on a couple of dates. Has it been confirmed, or is it just
I think they were under investigation, and I haven't actually got those. That was some time ago, so I haven't actually got the most recent information on that, but I'm certainly happy to get it to you.
Are you convinced now that church is alongside and working alongside you properly and not just necessarily cooperating with tests? I mean, there's certainly a lot of talk around their philosophies and their attitudes to COVID.
Yes, the feedback that I've had is that there may have been a little bit of resistance in the beginning, but that's been overcome, that there are good relationships there. The church is doing its part to encourage people who are involved with the church to get the test, and the testing numbers would indicate that that is working. Okay, last couple of questions, yeah.
Did you give verbal sign-off on the Green School bid in a conversation with James Shaw?
No, I had a conversation with James Shaw where I indicated to him that it was not a priority for education funding. It's not the sort of thing that we would fund through education. But of course, I'm not one of the ministers involved in the decisions around the shovel-ready project, so it was not a matter for me to sign off or otherwise. I wasn't involved in that process.
Why would Shaw say, though, that you did, you did give the
Look, that's a question that you'd have to ask him. I've always been very clear with him and with anyone else who asked that it was not a priority for education funding. It's not something that we would fund through Vote Education.
Do you think that Shaw isn't telling the truth?
Look, he can ultimately explain his thinking and his reasoning, but I was certainly very clear on the feedback that I gave him.
Can you just tell us exactly what was said during that time?
Well, look, I don't have an absolute transcript of it in my mind, but it went along the lines of this isn't something that we would fund out of education. If you're going to go ahead with it through a shovel-ready project, then you'll need to get it signed off through that process. But I was very clear that it's not something that I would sign off on if it was coming across my desk. It didn't come across my desk.
Are you going to talk to him about that future?
No, look, I mean, I think ultimately he's fronted up and owned the decision that was taken. I think it's very clear to everybody exactly how that came to be approved, and it's not a process that I was involved with. So, ultimately it's not really a matter for me. Last question over here.
Will the Ministry of Health be allowing the Wallabies, Springboks and Boomers to quarantine in New Zealand so that the rugby championship?
Look, that's a decision that's not yet been taken. So obviously there's a variety of different things that we'd need to look at around the quarantine arrangements. Bearing in mind my understanding of the discussions with them is that they want their quarantine arrangements to allow them to continue to train during that time. And so there's a lot of logistics that would need to be worked through as to whether or not that could go ahead. Decisions haven't been made on that at this point.
And the masks have been mandatory on public transport now for a few days. Has there been any action against people who haven't been compliant?
Not so far. We've seen really good levels of compliance. Where there have been the odd case of people not wearing them, it's normally because there's been a good reason for them not to wear them, like a health condition or whatever else. And I think the encouragement approach, what we've seen so far is that people, by and large, want to do the right thing. And actually, again, I want to acknowledge Auckland as everyone focuses on a small number of people who perhaps are making it difficult. Actually, the vast majority of Aucklanders understand the importance of what we're doing. They want to get this right. They want to get out of level 2. And they want to see the country out of level 2 as quickly as possible. And so we are seeing, people really playing by the rules, and I want to acknowledge that.
And so is documentation being handed to people within isolation and quarantine is recommending those with dispensing scripts go to the chemist warehouse. Just wondering why it's being recommended to go to an Australian-owned chain rather than the local pharmacy.
Look, that's news to me. I'm certainly happy to look into that. Okay. Yep, one more.
Dr. Ranger, why would someone who was travelling on the bus with that St Luke's case, it was about 10 days ago, the worker at St Luke's who took a bus and there was a big wide-scale publicity, they reported in and were told they were a casual contact. They were contacted yesterday and said that they were in fact a close contact and now need to undergo a test. What's changed there?
Look, I don't have the details of that, but what I can say is that as we go through the contact tracing process, which involves chains of transmission, more information can come to light. So I don't know the exact details of what you're talking about, but it's not unheard of.
Could there have been more people on that bus that effectively have tested positive that we're not aware of yet?
It's unlikely, because we would have become aware of them. So from my memory, the people on that bus were treated as casual contacts and provided with the advice that aligns with that.
Okay, thanks everybody. We'll wrap that one up here. The Prime Minister, with Cabinet is meeting in Wellington tomorrow morning, and the Prime Minister will do the briefing tomorrow afternoon. Thank you.